What we found is that the risk of heart disease was present both among those who had very high blood sugar levels, typically the amounts used to define diabetes, but also we found these risks present in men and women with moderately elevated blood sugar levels below the typical threshold of diabetes.
You okay with that? Right. Great, we're just going to start the noise of the scanner now.
Please breathe in. Please breathe in, breathe out, and hold your breath.
Men were between 30 and 50% at higher risk of heart disease. That's ranging from 30% at moderately elevated, the pre-diabetes level, all the way right up to diabetes level. Those same figures in women range from 50% to 100%, going from pre-diabetes levels of blood sugar all the way up to diabetes levels.
Going to move from some scans on your liver now, okay? Table's going to move.
We found there were 4 factors that explained the largest variation between men and women in the relationship between blood sugar and heart disease. Those 4 were 2 of them measures of obesity, body mass index, and our waist-hip ratio. The other 2 were the use of preventative medications like antihypertensive and statin medications. Women at every level of blood sugar level were more obese and had a more adverse waist-hip ratio than men in our sample. They, at the same time, had lower usage of preventative medications like statins and antihypertensive at every level of blood sugar. There's a spectrum, there's a whole range that we could have. If somebody lives more of an active lifestyle, eats healthy, doesn't smoke, they're typically going to be more on the lower end of the blood sugar levels. What we found is even those with moderately elevated levels, those that have pre-diabetes, as well as those who have diabetes, are all at risk for incident heart disease. And what we've been able to find is not only what is more commonly known, that people with diabetes have a range of risk factors like obesity and other lifestyle factors, but we found that these risks were present in both men and women below the threshold of diabetes. And it makes us really wonder about the clinical cut points that we're using to identify and define diabetes, and question whether we should be amending this cut point. What we need to know is how blood sugar impacts the risk of heart disease. We explored the rates in that it does exist. What we need to know is how.